Hello, everybody. Welcome to today's webinar sponsored by eAssist. We might just give it a couple of minutes. We have people still joining, and I wanted to just double check that we have everyone in before we get going. So we are excited, though, to welcome Jessica Martin today. She is going to present on the neuroscience of patient anxiety. And just love Jessica. I've known her for quite some time now. She has an extensive degree in psychology, which I think is going to be so fun just because she will take us through the neuroscience of patient anxiety. We know that, anxiety exists in patients. And so it's just kind of helpful to have someone who kind of knows what they're doing when it comes to this, give us some information and educate us about this. So let's see. Looks like we still have some numbers, but I want to get going. Jessica, how long is your presentation? I don't know if I had a chance to ask you that before we got going.
Yeah, about 45 to 50 minutes. So we should have some time for questions at the end.
Perfect. Perfect. That sounds great. So I just want you to know a little bit about Jessica. Like I said, she does have kind of an extensive degree in psychology, but yet she is strongly connected to dentistry through her marriage of a practicing dentist. And they own a dental spa. They reside in Wisconsin. They have two amazing children, which I'm happy to share that because I just love kids so much. And she has a passion for improving patient experiences. So when she brings together her extensive knowledge of neuroscience and psychology to empower dental professionals, it helps you create a more profitable and patient-friendly practice. Just a couple of housekeeping notes before I turn the time over to her. This webinar will last approximately an hour. If we, don't have any questions, we might wrap it up a little bit early, and one other thing to note is there is no CE offered for this session. I just wanted to throw that out there because sometimes we do offer CE, but today we're not. And then if you do have any questions during the presentation, please feel free to submit them in that little Q&A box at the bottom of your Zoom screen, and we'll try to monitor those, and we'll make sure that Jessica can answer those questions before we get to the end of her presentation. So I'm going to go ahead and turn it over to you, Jessica.
Thank you, Jacqueline. The first time I met Jacqueline, I remember I told her she looks like Olivia Newton-John, like the youngest version of Olivia Newton-John. So I can't look at you and not think that. So
Oh, that's
I
nice.
did.
Good tip. You're right. All
Excited to
right,
be
hold
here
on.
today.
Yep.
All right. So let's talk about dental anxiety and how we can take this concern or this challenge that a lot of our patients face and really turn it into positive practice growth. So today we're going to talk about what are the foundations of dental anxiety, what are the benefits that we can see for the business, and then we're going to talk about some actionable strategies that you can take back to your practice this afternoon or tomorrow to get working on improving case acceptance, reducing cancellations, and boosting referrals. So a little bit more about me. I have a master's degree in school psychology as well as an educational specialist degree in school psychology. And I worked in the education setting for about 10 years. I loved it. I worked with middle and high school students and it was very rewarding work. I also have been married to my husband for almost 20 years and he was in dental school when we met. So I definitely have a dental degree by association, if you will. And this is our practice here in Wisconsin, and we really have grown it substantially. I don't have a lot of our before pictures here, but we started out really humbly and grew the practice through the concepts I'm going to share with you today and really be leaning into an understanding of patient anxiety and creating such a better atmosphere for people. These are our two children. They are very feisty and keep us on our toes. Bennett is 9, Adriana is 13, and then our pup Nala there, she is almost 3, and she actually comes to the dental practice one day a week to help patients feel more relaxed and whatnot. She's kind of our emotional support dog that we've incorporated into the practice as well as just an extra fun thing. So we're always looking to innovate and find new ways to help patients have that better experience. So I started, as I mentioned to you, I started, working in my own field completely outside of dentistry. We owned the dental practice at the same time, but I really had very limited involvement. And my husband came home and one day and said, "Hey, I need you to come and run the practice for a bit. I just had 2 people resign and they're the only ones that know the front office. And so I'm going to need you to run the practice for a while." And of course I didn't feel prepared, didn't know anything about dentistry, dental billing, nothing, right? And if eAssist had existed, maybe you guys did, I didn't know of you at the time, I would have been forever grateful because I had to figure out all the things on my own, including all of the insurance billing and all the other things. So I started working in the practice, and about 6 months in, got all the systems kind of revamped, refined, efficient, all the things that I could, put my spin on it. And then I was able to step back and had trained a new person. Everything was running well, and was like, I could be done here, but I'm also seeing some plateaus in the practice. We're not growing at a steady rate. There's just a lot of holes, things were missing because my husband was very busy as a dentist. Running the business is like a whole other piece of it. So I started working on the business with his blessing. And that's when I really started to lean into the idea that there's a lot of psychology in dentistry and that everyone's kind of doing it the same way. And we could think about it differently and give people a much different and better experience. And that could be a huge practice grower as well, which is part of what we needed. So did that. The practice exploded. It's been wonderful, kind of downhill from there. There's of course always challenges. Like now we're too busy sometimes, and there's other things that come with it, but all wonderful things that we've encountered with the growth that we've had. And then in 2018, I started Martin Management, which is my consulting company where I help other dental practices as well as other people in the healthcare setting to improve their patient experience, improve their systems, get out of insurance networks, just do all the things that most private practice owners really dream of doing to make the practice better for them as well as for patients. So why dental anxiety? Why do we care so much? Well, it's very prevalent. A variety of sources have confirmed that about 70% of the population dislikes dentistry in some way. 19% are extremely anxious. Like these are the patients that probably don't come in unless it's really bothering them, or they do come in, but they're very fearful, very obvious that they're struggling to be there. And women are actually, quite a lot more likely to report dental anxiety. That doesn't mean we experience it more. It just might mean we're more willing to share that we have it. A lot of men also struggle, but they tend to keep it more to themselves. So it's very prevalent. Most of our patients don't really want to be there. Dentists hear it all the time. I hate the dentist. It's nothing personal, doc. It's just that I don't love being here. And there's a lot of reasons why. So some of them are that, we've created some societal stigma about dentistry. We talk, even though the language we use, things like, oh, that's like pulling teeth, or we talk about root canals being really scary. Just the things we say can really make people think, well, I've never had a root canal, or I've never had my teeth pulled, but I don't want that experience. That doesn't sound good, right? A lot of us have had negative experiences as children where we were held down, or where we were yelled at, or where we were pushed to just kind of take the pain or cry through appointments. A lot of people have had those kind of traumas, and so that's obviously going to create some feelings as adulthoods as well. And then a lot of people don't like needles, of course. Society has also come up with movies like from my childhood, Little Shop of Horrors, where the dentist is a serial killer, and then horrible bosses and root cause. And there's just a lot of reasons that dentistry doesn't really have like this positive, good feeling vibe to it. And then there's the sensory piece, which is what I get really excited about. That's the neuroscience of it, because that's something we actually can control. We can't control people's past experiences. We can't control the media. We have to use needles, right? But we can definitely have an impact on that sensory component and what's happening to the person's body and what's happening in their brain while they're with us in the dental chair. So we're going to get into that a lot more today as well. So the sensory experiences that most patients experience in the dental environment are very negative. So if you think of all the things, I'm not going to go into huge detail because you'll get the point, but the drill, the suction, the open treatment rooms, a lot of us have, you can hear side conversations, you can hear the drill from someone else's procedure next to you, the smells. I can remember walking into my husband's practice before I was there on a daily basis, and I would be hit with this wall of scent that wasn't pleasant, and that people there couldn't really even appreciate because they were used to it. They were desensitized to it. But our patients are with us every 3, 4, 5, 6 months. So when they do walk in, that is one of those first things that hits them. It's like when you walk into a hospital and you can just smell that anesthetic, and it's just not a good thing. And we can control for that, right? Seeing instruments is really scary. Like they're all very sharp and pokey, and makes people go, what are you going to do to me with those things? And we're giving people touch that's not necessarily pleasant. We're giving them injections. We're having them hold their mouth open. You're essentially digging in an orifice of their body, if you really think about it. And so it's just very unpleasant all around. Kids especially are more sensory sensitive. everything's new to them. So the bright lights, the masks, all of the equipment we have around that's unfamiliar, the textures, the noises, they're going to be even more attuned to those things and be cautious about what does this mean? And this doesn't seem like a good thing for me. So dental anxiety has a big cost as well on the bottom line. So when patients don't come in for their regular cleanings, that's costs us about $500 a year approximately. I'm probably undershooting some of these numbers depending on where you live, but patients that are anxious are more likely to cancel or fail their appointment. And that can, depending on the procedures that they need, can cost up to $30,000 a year. I did a hygiene course years ago, and the hygiene instructor said one appointment in hygiene, one hole in hygiene that isn't filled can cost the practice $30,000 a year if every week there's one hole. I'm like, wow, that's really, really substantial. Lower case acceptance, people that are anxious aren't, excited to follow through with the treatment that the doctor proposes. And so you're losing money there as well, depending on what's needed. People that are anxious aren't going to be talking about you in the community. They're not going to be sharing with friends and family how amazing you are. So you're not going to get a lot of word of mouth. Or if you get any, it's negative, right? They're the people that go on social media and say, oh, I had to go to the dentist today and it was terrible and this and that. No matter how good of a job you did, they're going to, run on that negative cycle because they don't enjoy it. It's not good for them, right? And then the last piece is team burnout. It is tough to be around people that don't want to be there. They're kind of maybe cranky. They're not feeling themselves. They're on edge. It's just really exhausting. And our team members absorb some of that, right? They're trying to make it better. They're trying to be more positive. And no matter what we do, if we're not controlling some of these sensory components or making it a better experience to reduce anxiety, it can really feel disheartening. When we can lean into addressing dental anxiety effectively, we can really find a way to differentiate our practice, because not every dental practice is going to do this. Not every practice cares about reducing dental anxiety. Some say they do, and then they don't do much about it, which is a little bit frustrating from my perspective, but that's okay. You can really create a niche with this, and that's what we've done in our practice, where when we do sponsorships or giveaways, we lean into the spa approach, and we put in spa-esque items or massage gift certificates and things like that when we do giveaways, when we donate a basket to something. All of it kind of goes together like a party theme, right? Everything has that vibe to it, and then it really feels really cohesive, and it allows us to stand out and be different. The approach of addressing dental anxiety really creates a magnetism for those ideal patients that we want, because people that are more attuned to having a better experience or to having a more calm, relaxing experience tend to have more disposable income. They tend to value experiences more. And so these are patients that are more likely to show up for their appointment. They're more able to pay for their appointment. They're maybe going to lean into cosmetic or higher end dentistry as well. The loyalty. When we have been able to help people through their anxious feelings about dentistry, they will go nowhere else. So whether they move across the country or we move our practice down the road, it doesn't really matter. They will find a way to come back to us, because we have essentially created such a unique situation for them where they know that they can get the work done that they need, where they feel safe, where they feel understood finally. And so they will of heaven and earth to stay with you, which is amazing. And you can get out of network and you can raise fees and do all those things because those people have found something unique that they know that they need and want. And then those people also tend to be huge advocates for the practice. They're going to tell everyone they know how amazing you are. They're going to talk about how it was different. And all of those things are really good for your internal marketing. And the clinical benefits, I didn't anticipate not being a clinician myself, but we've seen a lot of clinical benefits come from addressing anxiety. And it makes sense, really, when you think about it. A patient that is anxious is tending to be more closed off, right? They're going to be more internal. They're clenching their fists. They're not able to open as wide because they're anxious. So when we can get their body to get out of fight or flight, their body becomes more expansive. They're able to take a deep breath. They're able to open wider. They have less questions. So as a doctor or a hygienist coming in, to work with the patient and get right in there and do the work, a relaxed body is actually able to receive care more easily. And it can even create some efficiency in doing the work as well when they're not quite as much in fight or flight. So I like to think through the interactions that we have with patients, because I do believe that every single moment that we have with patients can be a place where we can really delight them or we can disappoint them. And for people that are anxious, they're already coming in with the mindset of, this is not going to be good. I don't like this. And so everything that every interaction they have is filtered through that lens as well, which makes it a little bit harder to delight them. But if we think about, I just assigned points. So you could just get some kind of an analytical understanding of what are these interactions and how impactful can they be. So the check-in process, seating the patient. Did you seat them on time? Were you friendly? Did you introduce yourself when you brought them out of the lobby area? Initial pleasantries. The dental treatment I gave a little more weight to because that's why they're there, right? So if we do that, not so great. It's worth probably more points here. Future treatment planning, the walkout process, the following up, all of those things. Essentially, it results into being about 13 opportunities per patient to delight or disappoint them. So let's just assume you're a single doctor practice and you have 6 patients in the doctor column, because some of those appointments are longer, some are shorter, and you've got 8 patients in your 2 hygiene columns. That's 22 patients in a day multiplied by those 13 opportunities, which ends up being 286 total opportunities to delight them or to disappoint them. This is why all the details matter, and this is why, and this is how, when we get all of these things right, we can really make a big impact on the experience and the dental anxiety that they're struggling with. So I think one of the first things that is important is that everyone on the team should be able to really clearly identify dental anxiety. And some people are really just good at kind of feeling the vibe of people and how their energy is flowing and how they're feeling, and others need more concrete clues. Sometimes patients are actually going to disclose how they feel over that initial phone call. They're going to talk to the person that answers the phone and tell them all the things about their previous experience or how they're anxious. And it's important that those people take down notes and share that with the team, right? So that person doesn't have to relay all of it again. So that creates some efficiency later. But sometimes when people are even just sitting in the lobby, you can kind of tell that they're anxious. And we're going to talk a little bit about nonverbals, but some people hide it really well. And, we've been taught in society that this isn't a big deal. Going to the dentist is something everyone has to do. And so some people really internalize it and try not to be a nuisance and try not to, show that they're fearful. So it's something we don't want them to just hide it. We want to kind of know, and we want to be able to help them through it. And so acknowledging and being able to spot it is important. I created this comfort form that I've got on the screen here way back when we first started doing this in our practice. And what it is it's essentially a questionnaire to ask, how does the patient feel about receiving dental care? It asks, have they had negative past experiences? And if they do report that they are a bit anxious about coming to the dentist, it actually gives them the language that they might not even realize is helpful for you to know about what aspects of the experience really cause them to feel anxious. So it will say, these are some common triggers: sound of the drill, seeing the needles, right? The temperature. So they can then just efficiently check, yeah, like those things do actually bother me now that I think about it. I've never really understood why I don't like the dentist, but these are things that stand out to me. Now as a team, we know how to work around those things. We know how to accommodate them. And now practices that don't even want to take it any further than this, I truly think that just even using this alone, this questionnaire, allows the patient to feel understood in such a way that they probably haven't before. We ask them 100 questions on their patient intake forms, their medical history, all of that, but we don't actually ask them how they feel. And so doing so takes that second to get into their psyche, and they're going to feel like, wow, they actually care about how I feel. And whether you do anything about it, whether you have, amenities like we're going to talk about, or you would make adjustments in your visit for how they feel, feeling understood is pretty amazing in general. So I am going to share this form with you toward the end of the appointment if you'd like to adapt it for your needs, because I do think it's really powerful. I had developed an adult comfort form and then an existing patient, so that you would use with your new patient paperwork. I also have one that I developed for existing patients that's a little more streamlined. And actually, when we pulled existing patients, which we thought we knew our patients pretty well. We were a smallish practice. We really pride ourselves on getting to know people. And we were pretty shocked actually at some of our patients that did disclose on the existing patient one how they were actually quite a bit anxious, and they were hiding it well. And so I think it is helpful to have that information. And again, it allows us just to bring it onto the table and have a more effective conversation about it. I also developed one for kids because they present a bit differently. So parents would fill it out, looking also more at some developmental and behavioral concerns that a child might present with, that if the dental team isn't aware of it or doesn't know what questions to ask, can make the dental visit go a little more hectic. And I've had some doctors tell me, wow, when you're bringing all this out, am I going to turn into a counselor? I don't really want to talk about that they're anxious. And I completely respect that. And I know you're not trained to be a counselor. I have a key that goes along with these. And I think that's helpful because it guides the team in, okay, the patient answered in this way. So here are some things we could encourage them to try, or some things we could do to help them through it. But if you use this form effectively, I think you can just, really look at it, kind of go through it with the patient initially, and just spot check the areas that they've mentioned. And it doesn't usually balloon into a big, huge conversation because they feel like you've got a really good understanding already with this form. So don't be too shy about that. So let's talk a little bit about those nonverbals, because whether the patient's in the lobby or they're sitting in the dental chair, they might be showing you they're anxious without you even needing to look at that form. Although, like I said, some people hide it well, and some clinicians, some team members aren't as good at being able to look at these nonverbals and just be able to tell right away. 7% of communication is actually in our words that we actually speak. The rest of it is all other things. So 38% is voice and tone, and 55% is body language. So it's huge. If we look at the eyes, are the eyes able to focus? Are they really darty? Are they looking around? Darting and looking around obviously is more of an anxious tendency, where if they're able to really focus on things and look you in the eye, that's more of a calm state. Hands are very telling. I use my hands a lot. You'll see that throughout the presentation today. But are the hands purposeful, or are they fidgeting? Are they clenched, or are they open, right? Is the voice shaky? Is it calm and steady? And then is it on any extreme? Is the voice really loud? That could be an indication of some anxiety. Or is it really soft? That could be anything on the extreme would be an indication of some anxious feelings. Thoughts and communication, are they able to have a coherent thought? Are they communicating effectively? Are their questions disjointed? How does that seem? Their body positioning, again, are they closed off and really holding on to themselves? Are they more open and expansive? And then movement, are they fidgeting around in the chair? Are they nearly hopping off the chair? Are they able to remain still and calm throughout that visit? Or it may be even in the lobby. Emotional intelligence, this is something, we've talked more and more about in society, but really understanding people is so helpful in all things, right? But again, some people are more naturally intuitive and able to kind of feel or easily determine how others are feeling. This type of individual would be a great dental assistant. Dental assistants, part of their job is not obviously just to hand over instruments and help the doctor, but also to put the patient at ease and help them feel comfortable, have a little small talk, really kind of try to understand the patient a little bit. Front desk people also, it's great to have emotional intelligence so that you can really be compassionate on the phone or at check-in when patients are maybe disclosing some negative experiences or some previous struggles. Some people are naturally good at this and these roles are great for them, and other people just need a little bit more practice, which is okay too. So let's get into some, actual strategies that you can use. And I think it really starts off with those first calls on the phone. Whoever's answering the phone, make sure they're the right person. Make sure that you can hear their smile when they talk on the phone. That's really important, because if someone does call and someone's not very warm or seems annoyed over the phone, that's really setting the tone for what your practice is all about. This is like that initial impression. So make sure they're empathetic and they're able to connect with patients. This is our office manager, Tiffany. She's been with our practice for 10 years. And I love showing her on this because she epitomizes this. She's always laughing with patients. She remembers little details. They have full-on conversations when she does interact with them, and it really puts people at ease right from the get-go. So for some initial phone call tips, I would say be genuinely excited to see people, ask open-ended questions, actively listen and gather information from the patient, but also take command of the conversation in a warm and confident way. So again, if the patient's like going on some tangent, gently and warmly lead them back to, all right, well, that's, really sounds like it's a struggle. We're going to take great care of you. When would you like to get scheduled? Do you prefer morning or afternoon, right? Getting them back to the task at hand after you've been able to provide them a little bit of leeway and listening to them. I do like it when teams are able to use a cheat sheet, especially with a new patient call, to really gather all the key details that are needed. Make sure you're taking down those concerns that they have. Again, they don't want to have to repeat it every time they interact with a new team member. And so if you're able to say, Thank you so much for sharing this with me. I'm going to make sure that the team knows this has happened before or that this is your concern. Now they know that it is relayed and they don't have to take the time with the clinical team to tell the whole story again. If the clinical team then obviously needs that information, can reiterate, we did hear that you're having some soreness in this area of the mouth. We're going to check into that today. Again, you're creating some efficiency and also putting the patient at ease to go, wow, this team really has it together. I told one person and they've related effectively, and here I am in the chair and I'm going to get this problem taken care of and I don't have to re-explain it all over again. And try to, if they are, disclosing something that's been difficult for them, try not to minimize it. A lot of times people will say like, oh, well, it's okay. Or, oh, goodness, I'm sorry. Instead, maybe say, thank you for sharing. I'm going to let the team know about that and reassure them with things like, you know what, we're going to take great care of you. Our team is so wonderful. We're so gentle. We're so personable, right? Give them that peace of mind that you've got them and that they're in good hands. And that's going to they want you to be the answer. They want you to have that confidence that you can do it better. That's why they've called you, right? So definitely lead with that if that's true for your practice. And then I think setting the tone for trust. Every interaction matters, like I said. So we're trying to build trust from all those first moments. So again, letting them know what to expect, whether this is on the phone or whether you're booking next appointment, letting them know like how long is it going to take and what they'll be experiencing. You might have a new patient that's, super nervous about receiving care, and they don't actually realize that on that first patient visit, you probably won't be doing dentistry. Maybe they'll get a cleaning, but you're not gonna extract their tooth unless it's an ER or something, right? But let them know so that they can mentally prepare for what's about to happen to their body. And if there is an opportunity to do some same day dentistry, great. But then again, let them know, hey, there might be an opportunity for doctor to be able to look at that tooth and be able to address it today. Are you okay with that? So that again, they can mentally prepare for what's going to happen, because people, when tend to be more anxious, their brain starts to just create all these stories that maybe aren't true. And so let's just avoid that. And the more we can let them know what to expect, the more they can schedule things appropriately so that they don't have a bunch of things stacked up, and now you're trying to get them out of there really quickly because they didn't plan accordingly, and now that stresses everybody out. And then I think over communicating is good. I mean, providing as many details as you can, confirming things, being reassuring. You want to answer those questions kind of before they ask them. You don't want to make things scary and provide details about the dentistry necessarily, but just letting them know about the practice and what to expect are all great things. And then, consistency really builds comfort. So, how that all of these interactions with the front desk team go can really set the tone for the whole visit. And so just making sure that people are able to do things consistently and competently in the front there. All right. So for some clinical strategies, we want to really think about the trust factor here. And even before treatment starts, we really want to think about having the patient feel safe and connected, because if they don't feel that, then as you start the dentistry, again, those anxious glasses are on, and everything they see, they're like anticipating it's going to hurt, it's going to be negative, it's going to be blah, blah, blah. Whereas if they're calm and feel trusting toward the team and they feel connected on some level emotionally, now they've got more of an open mind and heart to receive that care. And it might even be a good experience, right? So I really like, when teams consider the structure of the new patient experience, making sure that there is ample time with the doctor to really have the doctor get to know the patient, and not having them rush through the visit, because again, these are all first impressions. The patient isn't necessarily a lifelong patient at this point. And so let's put the time in the beginning of the relationship to really invest in that connection so that it can pay dividends throughout the lifespan of the relationship. Backing up to the comfort form, if the clinical team is able to review the comfort form with the patient, again, paying attention to those preferences of things that do trigger them. And then, if you're able to offer some different things to encourage them to try, that's a trust building and connecting moment that, oh my gosh, this team has a solution possibly for my problem and they're trying to help. That's really great. I love it when providers wash or sanitize their hands right in front of the patient. It's a small little thing, but a lot of times when people are anxious, they're looking for safety, right? They're making sure that everything is going to be clean and safe and all the things. So if you're doing that in front of them, as opposed to before you enter the room, now they're aware that you're good to go. And then I love it when teams ask personal questions, as well as those clinical questions. So obviously review what your plan is with the patient, but then also asking them a little bit about their life, getting to know them as a person, and then taking notes on that so that the next time the patient comes in, you can ask, well, how is that grandbaby? You were so excited last time you were here to spend time with him or her. How did that go? Or how was that trip? Or, how was your anniversary? Like patients just love to feel remembered and understood. And so those little details go a long way to helping them feel less anxious again about the whole experience. I also would love for dental assistants to stay with the patient as much as possible. So if doctor needs to leave to go do a hygiene check or something of that matter, the dental assistant to stay with the patient and do a little bit of chit chat, just make sure they're comfortable, observing their body language, checking in with them is really a wonderful thing. I know there's like lab work to do and sterile to keep up with, but again, investing in these small moments goes a long way for everything else that needs to transpire for the patient and for the practice. This kind of goes without saying, but I do see it when I'm on site with teams where people say certain things and I'm like, oh, please don't say those words. So I would definitely avoid using the word anxious with patients. Even if they do observe, you observe them to look a little anxious. I don't love giving them that word necessarily, because if they weren't and you observed incorrectly, now they're thinking, well, I wasn't anxious, but should I be? Like now I'm a little nervous. So you could say, are you comfortable? Is there anything I can do to make you more comfortable? So kind of tiptoeing around that a little bit, I think is great. And then avoid words like hurt, pain, blood, and needle. Choose soothing alternatives to those types of words to reduce some of those anxious feelings and all those pistons going off in their brain saying, this is not a good place. They're gonna hurt me, or this is not going to be pleasant like the last time that I was here. Um, I really like when doctors talk with their patient through the appointment, giving them cues before they're going to have a sensation. Like, you're going to feel a little bit of pressure, or we're going to spray a little bit of cold water here. Just giving them some of those cues so that they know what to expect for their body, and then explaining things as you go. So first we're going to do this, then we're going to do that. It allows the patient to kind of understand the process without overcomplicating it as well. And then offering calm yet confident updates. So you're doing great. We're almost done with this part. Awesome job. Some of the anesthetic techniques that are out there can reduce comfort or can reduce discomfort. Sorry. So obviously topical, and then warm anesthetic cartridges to their body temperature. It's a little tiny thing that can go a long way to helping it to feel less stingy and significant when you do that poke. And then I love when people triple check before their anesthesia before they begin working, because you'll hear those horror stories of people that were like, I wasn't numb, and the doctor just kept going, and either the doctor didn't check or the patient, didn't feel comfortable saying or whatever, but just really making sure that they're numb before you move forward. Let the patient know that if they need to take a break, or if they are feeling uncomfortable at all, that you will stop during their visit. So whatever that is for your team, whether it's like them raising their hand, giving them those stop signals so that they feel a little bit in control still while they're there. And then using some distracting things like, headphones, music, even some TVs up above them is great. Fidgets for kids, things to use their hands with, can all be helpful and offer them that sense of control and that distraction. And then I really think that clinical team consistency is important. So for most patients, they care about the hygienist that they see. But for anxious patients, especially, if you're able to assign them with the same dental assistant, even that can go a long way, because they've hopefully bonded and made some connection with the assistant they might have met before. And so if you're able to, I know that can be a scheduling situation sometimes, but when your patients are really anxious, if you're able to pair them with those same people, that's going to just allow them to go, okay, this person knows me. I don't have to go into everything with them, or I felt really comfortable with them. Or if it didn't go well, maybe switching it up to see if another person would be a better fit. So, and if, for example, their hygienist or doctor for that matter in a larger practice that they're going to meet with that day is going to be different, I think giving the patient a heads up on that is really helpful, even before they arrive, if possible, to just give them that choice of like, hey, you know what, your hygienist is going to be out sick next week. or we wouldn't know if she's sick next week, on vacation. Let's just say that. And so we have so and so filling in. She's also wonderful. I think you're really going to like her, but I just wanted to let you know, are you okay with that? Because if they're not, they're going to arrive to the appointment and be very upset that you did a bait switch on them. So I would rather reschedule them than have them arrive and have a really uncomfortable experience in the practice. And then the last thing I'm going to say here with clinical strategies is the doctor and the dental assistant, when the patient's receiving care in the doctor's chair, that rapport and that relationship, I think, is really wonderful for a patient to see and to feel. So I really like it when the assistant and the doctor can have a little bit of friendly, like chit chat and banter, but include the patient so the patient doesn't feel like you're just having a random conversation on top of them. You're kind of including them. So just give you an example. Like, so say the dental assistant had never been camping before or something. And so the doctor's like, oh, hey, Sally, how was that camping trip last weekend? I was thinking about you because I know you were nervous about camping. And then you tell the patient she's never camped before and she's not really a camping kind of girl. And then the patient feels like, oh, I'm included in this, right? Because they can't speak, you're in their mouth, but they feel like they're a part of the conversation. Now, why is this helpful? I think it shows the patient that, number one, there's a positive relationship between the doctor and the assistant, and that's nice to see as a patient, but also it shows that everything's going smoothly. When the doctor and the assistant can do their work and do a little bit of chit chat, it shows that everything is going well. It's when everybody is staring down with their eyes wide and everything is silent that the patient can read that this isn't going well. So if you have that kind of relationship with your assistant, or your team has that, I do think it's nice to be able to show that, you're confident and you're calm and you can have that like silly relationship even while you're doing dentistry. If it's something that's, easy and you're able to do it for, it goes a long way to helping the patient feel like put at ease that this is routine, something you do all the time, every day, no big deal. And they feel taken care of that way. Fear is incomplete knowledge. This is true for most people. So, the way that we end the appointment and the way that we handle like the whole experience, the more we can share with them and prepare them, the better. So, when it comes to like treatment planning with care that's needed next, explaining what's next, addressing, what would happen and if there are any questions. Sometimes even just providing like a written summary or something might be helpful, like a written treatment plan that they can take with them. I would avoid overwhelming patients with big decisions if they've just finished another big appointment. So like if you can tell that they were in the chair for 2 hours and they're kind of like, oh, that's done. Thank goodness. Now that maybe isn't the perfect time to say, okay, so like now we're going to do a 3 hour, root canal and we're going to do this or that. Like maybe that's best talked about another time, another day. Just kind of be aware that they're probably feeling overwhelmed already. And you can follow up, right? You can have someone call the next day to get them scheduled, really acknowledge like today went really well. Good job. You did so great and it went perfectly. With kiddos, I think it's important to, go a little bit slower and do the touch, show, do approach where everything's new, right? So showing them all the little, anesthetics and the prophy paste and just showing them all the things and getting them involved in that process is going to help their buy-in and allowing you to do the things you need to do to get through the appointment. And some kiddos need some gradual exposure. They need to just sit in the chair that first visit, and then maybe the next visit they're going to open their mouth, and then the next visit. And I know some providers are like, well, how do I charge a parent for an exam if we didn't get very far with the kiddo? And we always explain to our patients, like, our job here is to help the dental experience be really positive. And so I'm going to do the best I can without traumatizing your child to get what I can done. But their experience here and is paramount. And so I'm not going to push it further than the child is comfortable. Are you good with that? And most parents are like, yeah, that is great. If you have a parent that says, no, we just need to get this done, strap them down, let them scream, maybe you're not the right place for them, right? But getting that conversation out of the way and making sure you're on the same page is really good. And I think most parents don't want to force their kid through a really traumatic experience. So something to keep in mind about kiddos. I also think it's nice to have, if there's an older sibling that handles dentistry well, to have the kid observe that. Or observe the parent in their dental visit, just so they can see like this is okay, it's routine, and they'll be more familiarized when they do come in for their own visit. And then financial considerations, Avoid discussing large fees in the treatment room if possible, because again, like they're already feeling vulnerable. They're in a place where it's uncomfortable and they've just received care possibly. So if you have a consultation room, you use that, and using even like a round table versus a square table so it feels more collaborative and you're next to each other as opposed to across from each other can just feel a little less intimidating for people. And this comes from my training in education where, trauma sensitive practices. I mean, so many people have experienced trauma, and trauma isn't necessarily, something that you might think it is. So things like physical, emotional, and sexual abuse, we're pretty familiar that can be traumatic, but previous dental experiences can be traumatic. A bad car accident can be traumatic for people. Anybody that's, served in the military, it could be traumatic. It's something they've experienced. So to just be aware that, going slow, taking your time, getting consent from the person to move forward with touching them or to moving the chair back, those little things can go a long way to helping people just feel more dignified and like okay with the experience that they're having. So let's talk a little bit about some of the simple changes that you can do that can go a long way. So clutter, reducing clutter just feels good for everyone's mental health. So find those areas in your practice that are cluttered. Colors. I love when treatment rooms are actually a little bit darker because it doesn't feel as clinical. And so these are our rooms. They do tend to run on the darker side. And if you are wanting to go lighter and darker throughout the practice, I would just say to stay within the same color palette. So the lighter colors at the top, the darker colors at the bottom, stay in that same strip of color, because if you deviate into different strips of color, if you will, on these examples here, then you can pull in other shades and hues, and then it doesn't all tend to look as cohesive. This is actually our old practice, just to show you with some dated furniture and some things that it can still look and feel warm with just little things like color. Candles just create a nice ambiance. So I like to throw them, obviously, like they're not full flame. They're just battery operated, but they come on little remotes. So it's easy for the team to get them going. Music, again, creates a nice just ambiance. We like having this like waterfall scene on the TV in the lobby, or mountain scenes, or, beaches, whatever it is, just to kind of create a calming atmosphere for patients. Lighting can have a nice touch. You can do dimmers in your treatment rooms for people that are looking at sedation or that are sensitive to bright lights. Lamps, I think, just provide like a nice ambiance. Plants and nature, bringing that into the space is great. And then I just like to think about other industries. Like, what are other industries doing to stand out and be unique? And some of these, I'm not going to go through all the things that these each do, but each one has a specific way that they really wow their customers. And so I want you to think about, like, how can you wow your patients in every visit, and how can your practice be remarkable? Let's talk a little bit more about sensory. It's so important. It helps us to enjoy life. Like, it helps us to enjoy a good meal, or a song comes on and we are zoomed back to our childhood, right? It gives us that flavor and that richness of life. And they found a ton of sensory benefits for people with dementia, as well as for kiddos with developmental disabilities, which is, I think, why it clicked in my brain as a school psychologist that sensory was such an important piece of dentistry that we weren't touching on. And so one of the things I teach teams to do is really to bring in some positive sensory to the dental experience through the use of heat, through the use of coolness, through blankets, weighted blankets, things like that, to bring in positive sensory to calm the nervous system down, or to do things that will reduce negative sensory, like putting on headphones or covering the eyes. We want to either add positive sensory or reduce negative sensory to make it markedly better. So at our practice, we do things like noise reducing headphones, heated neck wrap, blanket, weighted blanket, all kinds of pillows, a cooled cucumber eye mask. We do a mini massage, and we have the dental chairs with the heat and the massage built into them. And it's just nice for people to have those options, because then they get to really cater the visit to what's going to work for them. Because not everybody needs heat, not everybody needs coolness, not everybody needs weight on them, but we can fine tune these things so that their experience is really unique to them and going to be sensory sensitive for them. And we also have a spa lounge where patients can wait and receive a chair massage as well. Again, just creating more comfort and a way to differentiate the practice. And I think that you can make your practice really beautiful, and your team can be friendly, and your systems can be really on point, which all of those things are very important. And I love to help train on, but I also think it's so important to really focus on what actually happens in the dental chair during the actual dentistry, because that's usually where our sensory system is really, just flying out of control. So I want to just take a moment to share with you the comfort form that I mentioned earlier in the presentation. I have a little bit left to share with you, but if you're willing to scan this QR code and just answer a few questions, I'd love to know what about the presentation you enjoyed? What parts did you not enjoy? The more I can share this with people, the more we can make dentistry better. And so this allows me to do this more effectively in the future. And when you get to the end of those questions, you'll be able to, you'll get the comfort questionnaire available to you as well. So I'll just provide just a few moments to get that QR code working for you. And you can also obviously complete it once we're done here on the webinar, but as long as you have it pulled up, then you're good to go. And then I just want to share with anyone that's listening in, you know, whether you're the doctor, whether you work at the front desk, whether you're an assistant, a hygienist, you are the change. When you can think of this differently, when you can think of, wow, my patients really need me to help them through this dental visit, and I really want to do what I can to make it better for them, that goes such a long way, because it's all of us doing these little things that makes such a big difference for patients. And you have the power. You have so much power in creating such a better experience for people. Ooh, sorry, went the wrong way. And mindset. So when the team has a mindset of, we really care about comfort, we really want to address dental anxiety better, the whole team functions just more cohesively, more consistently. It gets better just with the mindset shift. But what I also enjoy is that patients, when they know that your practice cares about their comfort, when that's how you lead in your marketing, which I would encourage you to do if this is something that is important to you and you're doing things to make it better, lead into that with your marketing, because now the patient has a new set of glasses on. This place cares about my comfort. And so they're now looking for proof that you care about their comfort, and they're going to find ways that it's better and different. And that is great for everybody. It sets them up in such a more positive and, empowered way to receive dental care. So I'd love for you to think about what you can do today. I gave you a lot of strategies, a lot of little tips on how to atmospherically change things in your practice, as well as some clinical and front office strategies. What are a couple of things you could bring back and incorporate right away today? You can't do them all. I mean, if you'd want to, I'd love to work with you, and we can work in that direction, but little things go a long way, and all the details will add up. So what can you do? And I love that eAssist asked me to do this webinar, because when you have a company like eAssist that's able to help the practice out, they can help in all of these ways. And so what this allows your front office team especially to do is have more time to build rapport with patients, have more time to make those connections and build trust and listen to the patient stories and relay the information to the team, right? It just allows everything to work more smoothly, so that patient care can be at the center of everything we do and not get pushed aside because we have so much work that we don't have time to do. And this is eAssist QR code. It looks like they're offering a complimentary consultation if anyone's interested on how they can be more supportive. And I just love to end with this quote. Some entrepreneurs think, how can I make a lot of money? But the better way to think is, how can I make people's lives a lot better? And if you get that right, the money it can't help but come. So I would love to get in touch with anyone that's interested in talking further about ways that they can improve their practice. It's been a sincere pleasure to be here with you today, and I'll turn it back over to you, Jacqueline.
Perfect. Thank you, Jessica. I appreciate you so much. It's been a pleasure having you here today. And thank you again for sharing all those strategies to help patients feel more comfortable when coming to the dentist. We all learned that anxiety is not merely an emotional response, it represents a neurological reaction. So that is so great to learn. And it was nice to learn, that they're feeling fearful. You're trying to help that fight or flight response. There's just so many things that you addressed today, and I love that. Speaking of reducing stress, I know you talked a little bit about eAssist at the end, and thank you for including eAssist. We try to reduce stress for you as dental teams, and so if you would like some help with your dental billing, Dr. James Anderson, who faced challenges in dental billing in his practices, started our company, and he envisioned a third-party solution to ease the burden of dental billing. And so thank you everyone for being here. If you want to go to dentalbilling.com to learn more about our service, you can do that. And thank you again, Jessica. I appreciate everything that you taught today. Our marketing team will send out the recording of this webinar to everyone who registered. So if you have team members who you would like to share this webinar with. You can go back and watch sections if you'd like. So in conclusion, we want to express our gratitude to Jessica for taking her time, for being here today, and then thank you also for being here and learning ways to help make dentistry better. Everyone, have a great rest of your week.